Hello friends, welcome back to the Nursing Exam Preparation YouTube channel. Today, you'll be attending a special session covering the 40 most repeated and most important questions and answers on psoriasis, designed for the NCLEX-RN exam 2025. So, let's challenge your knowledge and see how high you can score in this session. Question 1. What is the priority nursing intervention for a patient with psoriasis experiencing a flare-up? A. Apply a topical corticosteroid. B. Encourage sun exposure without protection. C. Administer oral antihistamines. D. Recommend frequent hot baths. Answer. A. Apply a topical corticosteroid. Rationale. Topical corticosteroids reduce inflammation and plaque formation during a psoriasis flare-up. B. Increases UV damage risk. C. Does not address inflammation. And D. May worsen skin irritation. Question 2. Which assessment finding is most indicative of severe psoriasis? A. Small, scattered patches on the elbows. B. Widespread plaques covering over 10% of body surface. C. Mild itching without redness. D. Single lesion on the scalp. Answer. B. Widespread plaques covering over 10% of body surface. Rationale. Covering over 10% of body surface indicates severe psoriasis per the Psoriasis Area Severity Index. A and D suggest mild cases, and C lack severity markers. Question 3. What is the most appropriate patient education for managing psoriasis triggers? A. Avoid stress and smoking. B. Increase alcohol consumption. C. Use harsh soaps daily. D. Expose skin to extreme heat. Answer. A. Avoid stress and smoking. Rationale. Stress and smoking exacerbate psoriasis. Avoidance helps control flares. B, C, and D are known triggers that worsen the condition. Question 4. Which medication is most commonly prescribed for moderate to severe psoriasis? A. Acetaminophen. B. Methotrexate. C. Ibuprofen. D. Diphenhydramine. Answer. B. Methotrexate. Rationale. Methotrexate is a systemic treatment for moderate to severe psoriasis, reducing cell turnover. A, C, and D are not specific to psoriasis management. Question 5. What is the priority nursing action for a psoriasis patient with signs of infection? A. Apply moisturizer. B. Assess for fever and redness. C. Encourage sunbathing. D. Increase topical steroid use. Answer. B. Assess for fever and redness. Rationale. Assessing for infection signs, fever, redness, is critical to prevent complications. A and D may worsen infection, and C is contraindicated. Question 6. Which skin care practice should a nurse recommend to a patient with psoriasis? A. Use fragrance-free emollients. B. Scrub skin with exfoliants. C. Take long hot showers. D. Apply alcohol-based lotions. Answer. A. Use fragrance-free emollients. Rationale. Emollients hydrate and protect skin, reducing irritation. B, C, and D dry or irritate psoriatic skin, worsening symptoms. Question 7. What is the best way to monitor a patient's response to psoriasis treatment? A. Check blood pressure daily. B. Evaluate skin lesion improvement weekly. C. Measure body weight. D. Assess lung function. Answer. B. Evaluate skin lesion improvement weekly. Rationale. Weekly assessment of lesion reduction tracks treatment efficacy. A, C, and D are unrelated to psoriasis outcomes. Question 8. Which complication is a nurse most likely to monitor in a patient with severe psoriasis? A. Hypertension. B. Psoriatic arthritis. C. Diabetes mellitus. D. Asthma. Answer. B. Psoriatic arthritis. Rationale. Psoriatic arthritis is a common comorbidity in severe psoriasis, requiring joint monitoring. A, C, and D are less directly related. Question 9. What is the most appropriate intervention for a psoriasis patient reporting psychological distress? A. Prescribe antidepressants. B. Refer to a counselor. C. Ignore the complaint. D. increase physical activity. Answer: B. Refer to a counselor. Rationale: counseling addresses psychological distress, a known issue in psoriasis, promoting mental health. A requires a provider, C is neglectful, and D may not suffice. Question 10. Which finding suggests a psoriasis patient needs immediate medical attention? A. Mild scaling. B. Open, weeping lesions with pus. C. Slight itching. D. Dry skin patches. Answer: B. Open, weeping lesions with pus. Rationale: weeping lesions with pus indicate infection, requiring urgent care. A, C, and D are typical or mild findings. Question 11. What is the priority nursing action when a psoriasis patient reports burning after applying a topical treatment? A. Continue application as prescribed. B. Discontinue the medication and assess. C. Apply more cream. D. Encourage sun exposure. Answer: B. Discontinue the medication and assess. Rationale: burning may indicate an adverse reaction. Discontinuation and assessment prevent harm. A, C, and D worsen the condition. Question 12. Which dietary recommendation is most beneficial for a patient with psoriasis? A. High-fat diet. B. Anti-inflammatory diet rich in omega-3s. C. High-sugar diet. D. Processed food intake. Answer: B. Anti-inflammatory diet rich in omega-3s. Rationale: omega-3s reduce inflammation, aiding psoriasis management. A, C, and D exacerbate inflammation. Question 13. What is the most effective way to prevent psoriasis flares during winter? A. Use a humidifier. B. Increase outdoor time. C. Avoid moisturizing. D. Take hot baths. Answer: A. Use a humidifier. Rationale: a humidifier prevents skin drying, a common winter trigger for flares. B, C, and D worsen dryness or irritation. Question 14. Which laboratory value should a nurse monitor in a patient on methotrexate for psoriasis? A. Blood glucose. B. Liver function tests. C. Serum creatinine. D. Hemoglobin. Answer: B. Liver function tests. Rationale: methotrexate can cause hepatotoxicity. Regular liver function tests monitor for damage. A, C, and D are less relevant. Question 15. What is the best nursing intervention for a psoriasis patient with joint pain? A. Apply heat to joints. B. Refer to a rheumatologist. C. Encourage bed rest. D. Ignore mild discomfort. Answer: B. Refer to a rheumatologist. Rationale: joint pain may indicate psoriatic arthritis, requiring specialist evaluation. A, C, and D are inadequate or inappropriate. Question 16. Which patient teaching point is essential for a psoriasis patient using phototherapy? A. Avoid sunscreen. B. Wear protective eyewear. C. Increase exposure time daily. D. Use during acute flares. Answer: B. Wear protective eyewear. Rationale: protective eyewear prevents eye damage from UV light in phototherapy. A, C, and D increase risks or are contraindicated. Question 17. What is the priority action for a psoriasis patient with a new skin infection? A. Apply a steroid cream. B. Administer antibiotics as ordered. C. Increase moisturizer use. D. Expose to sunlight. Answer: B. Administer antibiotics as ordered. Rationale: antibiotics treat infection, preventing complications. A, C, and D may worsen the condition. Question 18. Which sign indicates a psoriasis patient is at risk for dehydration? A. Moist skin. B. Dry, cracked lips. C. Clear urine. D. Normal skin turgor. Answer: B. Dry, cracked lips. Rationale: dry, cracked lips suggest dehydration, common with extensive skin involvement. A, C, and D indicate hydration. Question 19. What is the most appropriate response to a psoriasis patient feeling self-conscious about appearance? A. Minimize their concerns. B. Offer support and resources. C. Suggest covering lesions with makeup. D. Avoid discussing the issue. Answer: B. Offer support and resources. Rationale: support and resources address self-consciousness, promoting psychological well-being. A, C, and D are dismissive or unhelpful. Question 20. Which intervention helps reduce itching in a psoriasis patient? A. Apply a cooling compress. B. Use hot water soaks. C. Scrub the affected area. D. Apply alcohol rubs. Answer: A. Apply a cooling compress. Rationale: a cooling compress soothes itching by reducing inflammation. B, C, and D irritate or worsen the condition. Question 21. What is the priority nursing action for a psoriasis patient with a suspected allergic reaction to a medication? A. Continue the medication. B. Stop the drug and notify the provider. C. Increase the dose. D. Apply a bandage. Answer: B. Stop the drug and notify the provider. Rationale: stopping the medication prevents further reaction, and notifying the provider ensures safe management. A, C, and D are unsafe. Question 22. Which finding suggests a psoriasis patient needs a skin biopsy? A. Mild scaling. B. Sudden change in lesion appearance. C. Slight redness. D. Dry skin. Answer: B. Sudden change in lesion appearance. Rationale: a sudden change may indicate malignancy or worsening disease, warranting a biopsy. A, C, and D are typical findings. Question 23. What is the best way to assess a psoriasis patient's skin condition? A. Visual inspection and PASI scoring. B. Palpation only. C. Patient self-report. D. Temperature check. Answer: A. Visual inspection and PASI scoring. Rationale: visual inspection with PASI scoring quantifies severity and guides treatment. B, C, and D are incomplete or irrelevant. Question 24. Which precaution should a nurse teach a psoriasis patient using coal tar preparations? A. Avoid sunlight. B. Increase water intake. C. Use on open wounds. D. Apply to face freely. Answer: A. Avoid sunlight. Rationale: coal tar increases photosensitivity. Avoiding sunlight prevents burns. B, C, and D are unsafe or inappropriate. Question 25. What is the most important safety measure for a psoriasis patient on biologic therapy? A. Monitor for infections. B. Avoid exercise. C. Increase salt intake. D. Use tanning beds. Answer: A. Monitor for infections. Rationale: biologics suppress immunity, increasing infection risk. Monitoring is essential. B, C, and D are contraindicated. Question 26. Which intervention is most effective for preventing skin trauma in psoriasis? A. Use soft clothing. B. Scrub with a brush. C. Apply adhesive tapes. D. Expose to cold air. Answer: A. Use soft clothing. Rationale: soft clothing minimizes irritation and trauma to psoriatic skin. B, C, and D cause or worsen damage. Question 27. What is the priority action for a psoriasis patient with fatigue? A. Assess for underlying causes. B. Encourage overexertion. C. Administer stimulants. D. Ignore the symptom. Answer: A. Assess for underlying causes. Rationale: fatigue may indicate anemia or disease progression. Assessment guides care. B, C, and D are inappropriate or neglectful. Mage. Question 28. Which teaching point helps a psoriasis patient manage stress? A. Practice relaxation techniques. B. Increase caffeine intake. C. Avoid social activities. D. Work long hours. Answer: A. Practice relaxation techniques. Rationale: relaxation reduces stress, a known psoriasis trigger. B, C, and D, exacerbate stress or isolation. Answer: A, practice relaxation techniques. Rationale: relaxation reduces stress, a known psoriasis trigger. B, C, and D, exacerbate stress or isolation. Answer: A, use lukewarm water and mild soap. Rationale: lukewarm water and mild soap prevent irritation. B, C, and D, dry or damage the skin. Question 30. Which sign indicates a psoriasis patient is responding to treatment? A, increased scaling. B, reduced plaque thickness. C, new lesion formation. D, worsening redness. Answer: B, reduced plaque thickness. Rationale: reduced thickness shows treatment efficacy. A, C, and D indicate worsening or lack of response. Question 31. What is the priority nursing action for a psoriasis patient with a suspected drug reaction? A, continue the drug. B, discontinue and report to the provider. C, increase the dose. D, apply ice. Answer: B, discontinue and report to the provider. Rationale: discontinuing prevents harm, and reporting ensures safe management. A, C, and D are unsafe. Question 32. Which intervention helps prevent psoriasis flares during pregnancy? A, avoid known triggers. B, increase spicy foods. C, use strong perfumes. D, take hot showers. Answer: A, avoid known triggers. Rationale: avoiding triggers like stress or certain foods prevents flares, especially during pregnancy. B, C, and D are triggers. Question 33. What is the most appropriate response to a psoriasis patient's concern about appearance? A, dismiss their feelings. B, offer cosmetic advice and support. C, suggest hiding lesions. D, avoid the topic. Answer: B, offer cosmetic advice and support. Rationale: support and advice address self-esteem, a common concern. A, C, and D are unhelpful or dismissive. Question 34. Which laboratory test is most important for a patient on cyclosporin for psoriasis? A, blood urea nitrogen. B, liver enzymes. C, renal function tests. D, blood glucose. Answer: C, renal function tests. Rationale: cyclosporin can cause nephrotoxicity. Monitoring renal function is critical. A, B, and D are less relevant. Question 35. What is the best way to promote skin healing in psoriasis? A, keep skin moisturized. B, expose to direct sunlight. C, use abrasive scrubs. D, apply tight dressings. Answer: A, keep skin moisturized. Rationale: moisturizing supports skin barrier repair. B, C, and D irritate or damage skin. Question 36. Which finding suggests a psoriasis patient needs a dermatologist referral? A, mild flaking. B, joint swelling with lesions. C, slight dryness. D, normal skin tone.
Answer: B, joint swelling with lesions. Rationale: joint swelling may indicate psoriatic arthritis, requiring specialist care. C and D.
Question 37. What is the priority action for a psoriasis patient with a suspected infection? A, apply a topical antibiotic. B, assess and notify the provider. C, increase steroid use. D, expose to air. Answer: B, assess and notify the provider. Rationale: assessment and notification ensure proper treatment for infection. A, C, and D may worsen the condition. Question 38. Which teaching point helps a psoriasis patient manage itchiness? A, avoid scratching. B, use hot water rubs. C, apply tight clothing. D, increase salt baths. Answer: A, avoid scratching. Rationale: avoiding scratching prevents skin damage and infection. B, C, and D irritate or worsen itching. Question 39. What is the most effective way to evaluate psoriasis severity? A. Patient self-assessment. B. PASI score calculation. C. Visual guess. D. Temperature measurement. Answer: B. PASI score calculation. Rationale: the Psoriasis Area Severity Index provides an objective severity measure. A, C, and D are unreliable. Question 40. Which intervention helps reduce stigma for a psoriasis patient? A. Educate family about the condition. B. Isolate the patient. C. Avoid discussing psoriasis. D. Encourage hiding lesions. Answer: A. Educate family about the condition. Rationale: education reduces stigma and fosters support. B, C, and D increase isolation or misunderstanding.